sorry, Deputy Healy. Are you?
Corla, can I ask the Taoiseach again in relation to the mental health services in Tipperary? I've raised this matter, and of course also my colleagues in the constituency have raised it on a number of occasions over the past. Impact over the past year since the closure of St Michael's acute psychiatric unit in Clonmel. We now, of course, have no inpatient psychiatric beds in Tipperary, either north or south. Patients have to attend Ennis if they're in the North Tipperary area, which is in the old Midwestern Health Board area, in South Tipperary, who are in the old South Eastern Health Board area, have to attend Kilkenny, the unit in Kilkenny. Both units are overcrowded, are substandard, and are simply not providing a service for patients from Tipperary. What happens is that admission to these units are being delayed. When Tipperary patients are admitted, they are discharged inappropriately, I believe, ahead of time. There's no consistent follow-up of those patients, and it is difficult, if not impossible, for many of their relatives and friends to support these patients, either in Kilkenny or in Ennis, where obviously it is very difficult to travel to support families, and I've had families who have been on to me, and indeed other representatives on this issue for quite some time. We believe that beds, inpatient psychiatric beds, need to be provided in Tipperary. We need a seamless service, not just in one particular area, but right across all areas, the community-based service plus inpatient services, and we believe and we think that we are entitled, and we know that we are entitled to a quality service for patients in Tipperary. There's been a significant rise in the number of suicides in the county over the last number of years since the closure of these beds. And there's now a number of different organisations demanding that these beds be reopened. Tipperary Fight for Mental Health Services has organised many both meetings and protests, and the South Save Our Acute Hospital Services Committee have been in discussion with the Minister and with the HSE in the South East area in relation to this. And I think it's time, Ceann Comhairle, that a decision is made at the highest level for the introduction and the reintroduction of beds that were wrongly closed in Clonmel in 2012. Thank you.
Taoiseach.
Thank you. I just want to, at the outset, acknowledge Deputy Healy's ongoing interest and commitment to health services in the South East. I know on many occasions he's raised overcrowding at the hospital in Clonmel, which we're making some good progress on, in fact, and also mental health services in the South East. And I want to acknowledge his commitment to this issue and his ongoing interest in it. The move in mental health over the last couple of years, over the last couple of decades, in fact, in line with Vision for Change, which everyone signed up to, which is to move away from a residential and institutional model of providing mental health and psychiatric care towards one that is much more based in the community. If you go back 10, 20 or 30 years, huge numbers of people were treated in psychiatric hospitals, and over the years we've tried to do two things: to get rid of psychiatric hospitals and move them into mainstream healthcare, because mental health is mainstream healthcare. It should never have been treated as something separate, and also to reduce the number of people who receive the mental health services they need in a residential setting to a community setting, because most people who have mental health problems don't need to be in a hospital. They need treatment, and they can get that in the community, and they can stay in their own homes. And that has been the direction of travel, and I think broadly it's been the correct one. I do acknowledge, though, that on occasion people do need to be admitted, and therefore we do need a certain number of inpatient hospital beds. I'm advised in relation to the South East, there is a planning permission and construction beginning on a crisis house for the region. There's a particular focus on Tipperary when it comes to the distribution of advanced nurse practitioners and assistant psychologists, people working in the community who are qualified and can give people the support that they need. Minister Daly has visited the area already, met with the local reps, and is giving consideration to the inclusion of inpatient beds in new builds that are proposed for the South East.
Deputy Healy.
Thank you for the reply. I first want to acknowledge the commitment and the involvement of Minister Daly in relation to this issue, and he has met deputations on a number of occasions, and as you've said, he's also come to Clonmel to see the services on the ground. And I do want to say as well that we acknowledge, and have always acknowledged, the policy of Vision for Change, which would transfer the majority of services on a priority basis to community services. We have never taken issue with that. We've always supported that fully, but there does need to be a complete and a seamless service, and that would involve both community and inpatient beds. We do believe, however, that at this stage, and we've met the HSE management very recently again, they have acknowledged that there is at least 20 less beds in the area than there should be, and that South Tipperary and North Tipperary would have a priority case for these beds. And we do believe that at this stage, Taoiseach, that a decision needs to be made at ministerial level to reverse the wrong decision that was made in the closure of beds at St Michael's unit, and that a small number of beds would be put in place immediately. Thank you.
Thank you, Deputy Taoiseach, to conclude, please.
I want to thank the Deputy for raising this important issue and to give him my assurance that we will examine the matter that he suggests. Project Ireland 2040 provides over €10 billion for investment in our health infrastructure, in buildings and equipment, in ICT, and part of that will be the funding of an additional 2,500 inpatient beds. So perhaps as part of that expansion, those extra 2,500 beds, the appropriate number could be provided for mental health services in the South East. What we intend to do, where new beds are being provided, is not open old psychiatric hospitals, but rather provide mental health and psychiatric wards in existing hospitals, mainstreaming mental health as it always should have been. As I said centuries ago, I'm not sure whether it was Descartes or whether it was somebody else separated this idea of mind and body, that somehow mental health was separate from physical health. But of course we all know, and it may have taken us centuries and decades to relearn it, that mental health is intertwined with physical health, and it's right that they be integrated again.
Thank you very much, Taoiseach. That concludes Leaders' questions.